Hi, my name is Nikki, and I am a memory care expert here at A Place for Mom with over 20 years experience working in memory care communities. A spouse wants to know, what is the difference between a memory care facility and an assisted living facility? The biggest difference is that a memory care facility is going to have secured entrances and exits. So for people who are at risk of wandering out or getting lost, they'll be in an area that's safe. Your memory care communities will have different staffing levels. They might have more staff members for the resident population. They have specialized training, specialized programs to help support their residents as they progress through the different stages of dementia. All right, a caregiver asks, is there much of a cost difference between a memory care facility and an assisted living facility? It depends. So different markets have different price points, but in general, memory care communities will be more expensive than assisted living. A son asks, how do I decide between memory care and assisted living for my mom? She gets lost in familiar places sometimes. That's sort of the red flag that we're looking for a lot of times when it comes to determining what's the best fit. But at the end of the day, when you're touring communities and talking to them, they will have a nurse who will do an assessment, and they will determine what is the best fit for your mom. So whether that's starting in assisted living with some extra help with redirecting her to meals and activities, or if she truly is exit seeking and at risk of wandering out, then maybe having that secured environment will be the best fit for her. Again, the communities will be the ones to help you make that determination and figure out what the best fit is for your mom. A caregiver asks, what are the pros and cons of multiple small buildings versus one large building? Well, it really depends on your loved one and what is going to be the best fit for them. There's different pros and cons for every individual person. So for a small community, that might be a great fit for somebody who has mobility challenges. They can't navigate down long hallways, or maybe they would get too overwhelmed by a large community. Maybe they're not really into a lot of activities and socialization, and having a smaller, more intimate environment would be a better fit for them. Somebody who's very socially active or really needs room to walk around, a bigger community might be a better fit for them. Really, it's just going to depend on the comfort level of your loved one and what their physical care needs are, as well as social and their mobility abilities. Okay, a daughter asks, my dad has early stage Alzheimer's and lives at home. Does he need an assisted living facility? Well, that depends on what kind of symptoms he's exhibiting. Is he just pleasantly confused? Is he still able to remember to do things for himself or with some minor help from you? Really, it's going to be about what are you observing. Talk to his physician as well. It's never too early to get out there and get a plan in place. If you find a community you think your dad will love, get on the wait list. There is zero risk to getting on a wait list because you know eventually that's the place that you would like your dad to live. All right, a caregiver asks, my loved one has been in an assisted living facility for 2 years, but I'm worried about her cognitive decline. Do most facilities have on-site doctors or regular check-ins to transition residents to higher levels of care or memory care? So yes, a lot of our communities, assisted living and memory care, have physicians who come and visit their patients there at the community. Your mom's assisted living should have regular care conferences with you. So if they're seeing some decline or some concern to where they need to transition into a memory care community, that should be an ongoing conversation with you. So it shouldn't be a big surprise or something you wouldn't be aware of as that need is coming up. So definitely something to ask about when you're out touring is to find out what their coverage is of different medical professionals who come into their communities and how they can support your loved one.